Good afternoon, everyone. Reported cases of COVID in Ontario continue to decline, while cases in Grey Bruce were relatively stable over the last week. Due to the limitations on testing, this data must be considered less than robust. Most of the cases in the Blue Mountains have been resolved, and currently there are reported to be only 5 active cases in the Blue Mountains. The number of people in Ontario hospitalized continues to decline, with 2,634 people hospitalized as of yesterday. Numbers in ICU and on ventilators have also started to decline, while deaths continue to average about 60 a day. Currently, there are 16 people hospitalized with COVID in Grey Bruce. No deaths were reported in Grey Bruce this week. The data shows that having 2 doses provided good protection against severe illness and hospitalization. The latest data from the science table shows that if you are unvaccinated, you are 2.5 times more likely to get infected, 5 times more likely to be hospitalized, and 11.5 times more likely to end up in ICU than people who have received 2 or more vaccinations. It is therefore most important that you get your booster shot as soon as possible. A complete schedule of the planned clinics in Grey Bruce can be found on the Grey Bruce Health Unit website at www.publichealthgraybruce.on.ca. All individuals seeking a 4th dose must provide proof of eligibility, an official referral note from your primary care provider, a prescription, or a prescription bottle. In addition, Dr. Tim Remyard is offering vaccinations at the Blue Mountains Community Health Center in Thornbury. All community members are welcome. Appointments can be made online by visiting patient.mediohealth.com/booking/Dr. TG Remyard. Vaccines are also being offered at the Thornbury Pharmasafe. To be placed on the appointment notification list, please visit thornburypharmasafe.medmea.ca/schedule. On January 31st, Ontario began the process of gradually easing restrictions while maintaining protective measures, included but not limited to increasing social gathering limits to 10 people indoors and 25 people outdoors, increasing capacity limits to 50% in indoor public settings, including restaurants, and allowing spectator areas of sporting events, concert venues, and theaters to further operate at 50% seating capacity or 500 people, whichever is less. Enhanced proof of vaccination and other requirements would continue to apply in existing settings. The province currently plans to ease these restrictions further on February 21st, 2022 and March 14th, 2022. Subject, of course, to stable or improving health indicators. Today, the town announced that SHS Consulting has been retained as the development management consultant to help guide the Community Campus of Care project forward. SHS Consulting will be responsible for working with the town 125 Peel Street Task Force and Council to source a private sector partner or partners to develop, own, manage, operate, and maintain the various components of the Community Campus of Care. SHS Consulting and the town will create a pre-qualification process to attract and qualify developers and long-term care providers to the project. Once pre-qualified, the shortlisted providers will be invited to move on to the final request for proposal that will be issued later in 2022. The Campus of Care project utilizes the provisional 160 long-term care beds recently allocated by the Ministry of Long-Term Care to the town of the Blue Mountains and the property owned by the town at 125 Peel Street, which the town is working to make available. The Community Campus of Care project is an innovative and unique collaboration between the town of the Blue Mountains and the province of Ontario. The proposed Community Campus of Care is expected to feature a 160-bed long-term care facility, retirement living accommodation focused on healthy seniors living, and a variety of attainable housing units and dwellings to support the staff working on the Community Campus of Care. Have a great weekend and stay safe.